Hi, this is Madison Fornoff. I sat down and talked with
Dr. Richard Joseph.
And he is
I'm an oral maxillofacial surgeon.
You aren't 100% confident of what that actually means? That's okay. Neither did I. He and other surgeons like him deal with conditions and injuries related to the jaw, head, mouth, and face. Common procedures include corrective jaw surgery, oral reconstruction, dental implants, and removal of impacted wisdom teeth. He was kind enough to share a bit about himself before he got started.
I have an office in private practice since 2005. Originally, I opened my office in the Baptist Hospital in 1977 and was there until 2005. I'm hospital affiliated with Baptist Medical Center downtown.
Quick note, Baptist refers to a 7-hospital health system located in the southeast U.S. They're headquartered in Jacksonville, Florida, and they're associated with Wolfson's Children's Hospital.
What made you pick Baptist?
When I came to Jacksonville in 1977, there were only about 12 oral maxillofacial surgeons in the city, and there were none practicing at Baptist. And Baptist was trying to recruit young doctors. When I talked to them, they were willing to give me a real good break on first few months of rent and so on. And they did that with all the young doctors that they had. And so they got a staff of all American trained physicians coming out of school or residencies, and they built themselves as a premier medical center. Richard Malone, who was the administrator of the hospital at the time, he had a vision, and I was part of it.
Dr. Joseph was born in 1948 and grew up in his Jacksonville home where he was the second oldest of his 4 brothers. Dr. Joseph was one of the 2 doctors out of the boys. 2 more were lawyers, and a 5th was a successful businessman, who Dr. Joseph joked was more well-off than any of his higher educated brothers. The brothers have a family history of Syrian on their mother Francis's side, while their father, Joseph, has family from modern-day Lebanon. Back then, it was also part of a country called Syria.
So, before we get into your education and residency, how long have you been practicing?
Been practicing for 45 plus years.
So where did you get your education and training?
I went to Emory University in Atlanta and got a bachelor's degree in biology. And then from there, I went to the Emory Dental School and got a dental degree. I then went to New Jersey College of Medicine and Dentistry and did a 1-year hospital general anesthesia residency. And I did that because oral surgeons typically do office anesthesia, and I felt like it would be something that might help me and help me decide if I really wanted to do oral surgery. I'd get to see it. So after doing that, I applied to residencies and was accepted to Emory School of Medicine and Emory School of Dentistry. Had a combined program at Grady Hospital in downtown Atlanta. So that's where I did my residency.
After learning about where Dr. Joseph got his start, I wanted to move on and talk about the work he does today and his favorite procedures to perform.
Well, the main procedures I perform today are different what they were when I began. When I began, it was primarily traditional oral surgery, meaning the removal of teeth, operation of the mouth for dentures, partials, etc. And I did a lot of facial trauma. I was on call at Baptist Hospital. I probably had 3 or 4 patients in the hospital at any one time all year long. Yeah, I made rounds every day in the hospital, but my office was next door to the hospital, so it made it easier to do. But also, the hospital and all the other doctors that were down there said, well, if anything that we need from an oral surgery or dental, got a guy here right in the complex. So I ended up getting a lot from that, and I got a lot of reputation of being a hospital-based oral surgeon and one that did more complex cases. But my practice started where I was doing primarily what we call dentoalveolar surgery. That's the removal of teeth. Dental implants that we do today didn't happen until probably the mid to late 80s. Cosmetic surgery I began doing in the 80s. Orthognathic surgery I began doing as soon as I got here in 77.
Orthognathic surgery refers to corrections done to the jaw and teeth to improve the way they work that cannot be accomplished by orthodontics alone. People get this done for jaw pain and misalignment and for trouble breathing and sleeping. It can involve the surgical movement of the mandible, maxilla, or chin, or sometimes all three. Cases can take up to a year to prep before they are ready to enter the OR.
It's evolved quite a bit since then. I would say I've done more orthognathic surgery and major procedures than anything else. Probably done 2,000 in my career. Other things that I've done, obviously, are the simpler things like Botox injections, dermal fillers, and we've done facelifts, eyelids, laser treatments. But I would say the most rewarding and most challenging has been corrective jaw surgery, orthognathic surgery.
Do you think when you retire that there's going to be kind of like a gap in the industry? Something that you do that cannot be replicated by somebody else?
Things that I do that no one else in the community currently are doing. There are approximately 42 oral maxillofacial surgeons in the greater Jacksonville, North Florida area. No one else does orthognathic surgery other than perhaps an occasional case, one every 3 or 4 years. There is, however, a residency training program here, and so there's some being done in the residency training program. But in terms of private practice, I am unique in that.
Tell me something about yourself that isn't on your resume.
Well, I paint and I sculpt.
When I first met Dr. Joseph and walked through his office, I noticed the paintings complementing each passing wall and the small handmade sculptures in each exam room. Even the doors and trim had a warmth and depth not typical of a modern doctor's office. He told me that many of the art pieces were made by him, and he put great thought into how he wanted his office to feel and look. He originally aspired to go to art school, but ultimately went the medical route instead. In 2003, he was able to realize his aspiration and attend university.
And ultimately got my degree. I've continued to do that. I've continued to paint. I continue to sculpt.
Do you think when you retire, that'll be your pastime?
I think it'll be something that, I think it will be.
For the second half of my questions, I had Dr. Joseph do a self-evaluation, give me his opinions on the current landscape of the industry, and let me know what he plans for the future.
How have you evolved or grown as a leader throughout your career?
In terms of being a leader, I think I've grown because as I've gotten older, I've gotten more sage. I've held some positions in organizations that have propelled me into being a leader in the profession. In my early years, residents from University Hospital, Jacksonville, spent 6 months of their last year with me doing jaw surgery, learning to do jaw surgery. So I trained at least 20 surgeons that were in their residency. They weren't doing corrective jaw surgery at the time at University Hospital.
University Hospital refers to a level 1 trauma center in downtown Jacksonville. It was originally named Duval Medical Center until 1971 when it partnered with the University of Florida and was renamed to University Hospital. It was later purchased by Shands Healthcare and was renamed Shands Jacksonville Medical Center. Today, it has been renamed to UF Health Jacksonville.
But they sent their residents to work with me because they weren't doing corrective jaw surgery.
Do you keep up with any of those residents?
Yeah, I do.
Dr. Joseph began listing prominent doctors in the community who I did not know worked with him during their residencies. Funny enough, several of them are either about to retire or have already retired before Dr. Joseph.
One of the residents that worked under you is retiring before you.
Yeah, several. The other oral surgeons in the region consider me to be the grandfather or the godfather. I have served as president of the Florida Society of Oral Maxillofacial Surgeons. I served on several national committees. And so those things didn't happen year one. They happened after I had become established and had developed a name in corrected jaw surgery. And it wasn't the degree that gave me the ability. It's the experience. Doesn't matter if you're a DDS or DMD or an MD or a DO. If you have the training and the experience and can be proficient, then you can get the right to perform those operations. I was extremely lucky and well respected by my physician colleagues at the hospital. I mean, they saw me in the emergency room 3 nights a week. They were down there. I was down there. We're in the trenches together.
Dr. Joseph has put in the time and effort to master his skills and perfect his techniques. I wanted to find out if there was anything else he believed a provider can do to set themselves apart.
Of your many skills, what one do you feel differentiates you from others?
I consider my greatest skill to be, I was going to say my greatest skill would be to be an artist as opposed to a technician. But I think my greatest skill would be my ability to communicate with others and make them feel very important. I think patients come here and I try to get to know them. I try to make them feel like they're special and they're part of my family. And I think that is, I don't know if it's a skill. I don't know if it's something I just got from being raised that way. But I think most patients would always say, he really did spend time with me and he really was a nice man and he really was truly concerned about my well-being.
I wasn't sure how Dr. Joseph was going to answer this next question, but I felt it would give an insight or give a new perspective to any future surgeons. I asked him if there was any disappointment he felt from his career and if he could go back and change anything or if he wants to change anything for the future.
The greatest disappointment, I think, to me, is that I have not been able to find or bring in or entice a young surgeon to come in with me, and that I will be leaving practice without having passed the baton. That's a real disappointment. I was hoping I'd get to do that, and it hasn't happened.
Not yet.
Not yet. I still am not giving up, but it's become more difficult. 10 years ago, it would have been easier because the young oral surgeons coming out would want to go into a private practice. Today, they all want to work for corporations.
What changed?
Well, corporations, they're big, they advertise, and they'll pay a starting salary of $500,000 to a young surgeon coming out. So all he has to do is take out teeth and makes $500,000 a year. Doesn't have to go to the hospital and do emergency surgery, doesn't have to do any trauma, doesn't get to do any orthodontics, doesn't do any cosmetic. He goes in at 9 and leaves at 4:30, and he makes $500,000 a year and gets a $50,000 signing bonus to go. That's hard to compete with.
At the time of this recording, I could only find one job posting for an oral surgeon that showed the salary in Jacksonville, Florida. It was for one of the major corporations that Dr. Joseph mentioned to me. It was a starting rate of $600,000 for a 40-hour work week.
So there aren't too many solo practices that are transitioning. I'm very proud of my friend Clive Rayner. He sold practice to a young guy. It was a guy that was out of the Army and not somebody right out of residency, so he had already paid off his student loans. Whereas the guys coming out of residency, they're in debt $700,000-$800,000.
When researching, I found conflicting results. I saw a survey that the average debt for an oral surgeon was around $350,000, but I found some sources that had it upwards of $500,000 to $700,000. It most likely varies depending on which school they go to and the cost of living for the city they're in.
And so for them to come and buy into this practice, they got too much debt. They can't do it. So the disappointment is I don't have someone to replace me.
For my final question for Dr. Joseph, after 45 years of practice, I asked him what he wanted his legacy to be.
The legacy I want to leave is that I was a kind, benevolent person that cared about my patients, and that I had a gift and a talent and a skill to perform certain procedures that were very uncommon. I think patients will remember me as a guy that not only cared about them, but had a gift to be able to help them with their aesthetics and self-esteem, their occlusion, their breathing, their everything else. So that's the legacy I would leave. I don't regret anything like that I've done that in that regard. And I don't know that I would change anything And I really hoped that I would be able to train or mentor a young, not necessarily young, but younger surgeon to take my place. It's really that's kind of a disappointment that I don't have that.
As we were wrapping up the interview, I asked Dr. Joseph if there was anything else he'd like to speak about. First thing that came to his mind, and the only thing he mentioned, was his family.
What I would say is things that are important to me are family. I have 2 sons, 6 grandchildren. Enjoy spending time with them and seeing them grow up.
And your partner.
And my partner, Denise, she actually was my very first employee. She passed out when we did the first case. She got woozy from the procedure.
He told me more about how Denise came into his life, and more about his 2 boys, Richard and Eric, as well as their kids. I have no doubt that once Dr. Joseph retires, he'll be spending majority of time with his family. I think that will be his greatest legacy: a caring dad, partner, and grandfather.
Yeah, I've been blessed. I really have been blessed. And I'm still enjoying life, thank God. I want to travel a little more. And I want to take a little more time off. And I think I'm going to get the opportunity to do that.
I'd like to thank you for taking the time to listen to my conversation with Dr. Richard Joseph. If you'd like to learn more about him or see the results of some of his corrective jaw surgeries, you can head over to his website at drrichardjoseph.com. That's drrichardjoseph.com. This interview was inspired by a prompt given to me by my professor, Dr. Ashley Troy, at Florida International University Master of Health Administration program. I'd like to thank Dr. Joseph for taking the time out of his day to help with this project of mine. It was a pleasure learning more about you.
Dr. Joseph, that is all my questions I have. I appreciate you taking the time to do this.
You're welcome.
We'll let you get back to your actual work.
Okay.
Well, I hope you enjoy your weekend.
Thanks. You too. It's time to get out of here, I think.